to this list at any time without public discussion or even knowledge by simply posting the change on their webpage. While existing law demands that the board get the PA Advisory Committee input on any action concerning PAs, it is under no obligation to take that advice, leaving the final decision on what level of supervision the supervising physician must maintain for any procedure delegated to a PA in Louisiana solely to the 6 members of the board. While we all know that there are physicians and PAs who have not always performed as would be expected, limiting the delegatory process to all physicians, in doing so, limiting their ability to appropriately utilize the needed addition of healthcare team that a PA provides cannot be in the best interest of the people of Louisiana. Alienating physician assistants and the physicians they work for has a vast potential for decreasing the number of physician assistants, the 12th fastest growing profession in the U.S. according to the Department of Labor and Statistics 2 years ago, in a state where the population in a health professional shortage where according to the Health Resource Services Administration, over 30% of the population are in a health professional shortage areas. PAs will look for areas where they have more flexible and friendly laws to best utilize their training and experience, such as Texas, Mississippi, and Arkansas. Physicians who are used to working with PAs, either through their present practice or during their training, may be more inclined to look elsewhere to locate their practice. Training programs will suffer from the lack of the best qualified students and may completely fail. Hospitals will suffer to find enough qualified healthcare professionals because of further restrictions of this rule imposed on the way the physician may supervise a PA if they are employed in that hospital, limiting access to care even further. The physician assistant team has a long history in this country of providing high quality, accessible, and cost-effective healthcare. When looking at this proposal, one must ask if the board has studied the potential for not only disruption to present healthcare delivery, but also the economic impact that this will have on patients, individual physicians, healthcare institutions, and the state of Louisiana. Thank you for your time.
Thank you, Mr. Stevens. Our next speaker is John Allgood. Thank you. Yes.
Thank you, board members. My name is John Allgood. I've been a PA in the state for 35 years. In fact, I'm the first licensed PA in the state of Louisiana. I'm presently the program director at Our Lady of the Lake College in Baton Rouge. And I also represent Dr. Richard Bistrop, a laryngologist, for which I've been in practice with for 35 years. I'm a founding member of the Louisiana Academy of Physician Assistants and have served this board as a past member of the PA Advisory Committee. I would like to make a few comments. PA practice is members of physician-led teams. The supervising physician is in the best position to determine whether a PA is competent to perform the delegated task and decide what type of supervision is appropriate. The law currently confers the responsibility for assuring that the PA is competent to perform delegated tasks on the supervising physician and the PA. Some procedures should require the close proximity of a physician, but this should be determined by the physician, the PA, the credentialing and privileging decisions of the facility. Authorizing the board to change requirements by posting new provisions on its website will make it impossible for physician PA teams to assure that they are in compliance. This action will reduce the demand for PAs and decrease the number of physician PA teams in this state when we need to expand the numbers of healthcare providers to meet the increased demand for healthcare as a result of healthcare reform. This action will impact patient access in healthcare in a negative way. This will impact my clinical practice by restricting the simplest of procedures accomplished during a normal otolaryngology physical exam, such as otoscopy, rhinoscopy, and laryngoscopy. Our Lady of the Lake College believes that adopting the proposed rules would be a significant setback for the PA profession in this state. It will negatively impact patient care and restrict employment of PAs. Nationally, other states are expanding practice laws. In order to serve the citizens of the state of Louisiana during this area of healthcare reform, we strongly urge the non-adoption of these proposed rules that were published by the board on July 20th, 2011.
Thank you, Mr. Allgood. The next speaker is Dr. Gene Barrett.
Good morning. I'm Gene Berry. I'm a cardiothoracic surgeon in Baton Rouge, and I appreciate the opportunity today to speak briefly on the matter. I primarily rise to call attention to the letter that was sent to the board by the Society of Thoracic Surgeons. Do each of you have access to that letter, or have you seen it in the course of your review of the subject?
That letter has been received and will be reviewed by all boards.
So I don't need to present it to you. If I may, however, let me just read a few sentences of that letter. As you're probably aware, the STS is the major national society which represents and assists cardiothoracic surgeons throughout the country. They oppose the proposed changes, and in that letter they have stated that in the course of daily practice, cardiothoracic surgeons rely on skilled and well-trained PAs to accomplish a variety of tasks ranging from basic bedside care to more demanding clinical procedures. Since cardiothoracic surgeons are ultimately responsible for patient outcomes, they do not grant PAs the authority to undertake procedures which are beyond their skills or would compromise the quality of care. PAs play a vital role in the best practices developed through the STS national database and accepted by practicing cardiothoracic surgeons across the country. The proposed restrictions have the potential to limit their efficacy and reverse the positive trend and improved outcomes that we have observed. As a professional organization representing cardiothoracic surgeons in Louisiana, practicing under the rules and regulations promulgated by your board, we respectfully request that you rescind your proposal and restrict the practice of PAs in the state of Louisiana and rely on the best practices developed by our specialty working with PAs to enhance the quality, resulting in improved patient outcomes. I also would like to endorse this letter on behalf of my group in Baton Rouge, the CVT Surgical Center. We're a group of 10 cardiothoracic and vascular surgeons who've successfully used physician's assistants in our practice at Our Lady of the Lake, Baton Rouge General, and Oxnard Medical Center hospitals for some 30 years. Without unduly dissecting the details of your proposal, let me summarize by saying that we find the changes illogical, overreaching, and replacing the current system with unnecessary complexity derived from ill-advised micromanagement. In our practice, the result will be reduced quality of care and needless harm to the patients that you're trying to protect. Our strong opposition is derived from our long-standing positive personal experience with physician assistants. We are totally unaware of the problems you're attempting to address with these proposed changes. However, we do stand ready to assist or work with you to develop reasonable solutions to your concerns in a way that corrects problems without destroying a system that has been proven to work well. We respectfully request that you don't throw out the baby with the bathwater.
Thank you, Dr. Barrett. The next speaker is Christian Jacoby. I'm sorry, how do you pronounce it?
Jack.
Jack. Thank you, sir.
Good morning. Thank you for the opportunity to address the board and fellow PAs, teachers, fellow PA students that are here as well. To save time, most of the issues as far as students we feel have already been addressed, but I felt it necessary to come up here and let you know how students feel looking at these prospective changes. The feeling among students is a sense that we may lose our ability to work with the brilliant physicians here in the state, and not necessarily just to work with, but to work at the full of our capabilities. most of us here and at LSU, HSC, and Shreveport have taken